So welcome everybody. I don't have any disclosures. So this is both the objective and the take-home message for this talk today. Really, all children with celiac disease should have healthy bones, but a key to making that happen is that we have to diagnose celiac disease early in childhood, and we need children to grow into adults who continue to follow a gluten-free diet. So our specific learning objectives, just to understand how bone health is impacted by celiac disease, what is the treatment for poor bone health for children with celiac disease, and to consider when children with celiac disease might need a bone density scan. So in 2018, and really for a long time now, children with celiac disease don't look particularly unhealthy. They often just have minor tummy aches. Their doctor might say it's irritable bowel syndrome. Perhaps they get recurrent headaches, joint aches, or are just very fatigued or have difficulty concentrating. And sometimes they have no symptoms whatsoever, but they've been screened for celiac disease because of a parent diagnosed with celiac disease or a sibling. And what this means is that doctors have to think about the diagnosis of celiac disease very carefully to recognise that it can occur for children with very minor symptoms or no symptoms whatsoever. But looking healthy with celiac disease doesn't mean you're not at risk of complications from celiac disease, and that's really what we're here to talk about today. We consider poor bone health to be a silent complication of celiac disease because really it doesn't present often till much later in life when the child might have an osteoporotic fracture as an adult. So celiac disease in Edmonton and everywhere else in the world is on the rise. This is just the figures from our clinic in Edmonton, and definitely you can see the increasing number of children who are referred every single year for the question of having celiac disease, and these are the ones that were actually diagnosed. So the reason why bone health during childhood matters so much is because this is really the time of life when you build your healthy bones, or what we call healthy bone mass, which is really the amount of calcium that goes into the bone structure, and that gives the bone strength and helps you avoid fractures. Later in life, we actually start to lose our bone mass. That happens as we get older, and particularly for women, it happens after the menopause. So if we don't build strong, healthy bones during childhood, then we're at risk of the early onset of osteoporosis or a risk of fractures in mid to late adulthood. And this slide shows how impressive that gain in calcium is over your lifespan. So a newborn baby just has 25 grams of calcium in their skeleton, but by the time they're an adult, they've increased the amount of calcium 50 times. And most of that comes just from growing during childhood. But a very important amount of it comes around the time of adolescence, when there is actually not just increasing calcium in increasing bone size, but there's actually extra calcium laid down into the bones to make them even stronger. So there are three critical things for healthy bones during childhood and later in life as well, but for sure sunlight is a very critical thing because it helps provide vitamin D, and vitamin D helps us to absorb calcium from our diet and to put it down into our bones. A balanced diet, eating from all food groups, is very important for bone health, and as is exercise. So children and patients with celiac disease are at risk of poor bone health because they have damage to their small bowel, and that means they don't absorb the nutrients from food that they need. And you can see really it is all food groups, from grains through to getting protein, which is very important for bones. Vitamin K comes from leafy vegetables and is important for bones. And of course, we all recognize that calcium from dairy products is a key nutrient for bone health. One of the reasons, in addition to malabsorption for children to be at risk of poor bone health, is that many of the gluten-free foods are not fortified with nutrients the way gluten-containing foods are. For example, cereals that are fortified with vitamin D. So that's an additional reason for children to be at risk and patients for celiac disease to be at risk. And vitamin D actually seems to be very important because we know that it's critical for this outer layer of bone called compact bone, and that many of the fractures that individuals with celiac disease experience particularly affect that part of the bone. So this is what happens when bones go bad. So obviously fractures is the consequence that we're most worried about. This X-ray shows the most common type of fracture for adults with celiac disease, which is called a Colles fracture of the wrist. It's also called a dinner fork fracture because the wrist often looks like a bent dinner fork after it's been broken. And this type of bone for this type of fracture is mostly compact bone. And so it's the type of bone that's very sensitive to vitamin D. And of course, for children, if they're not getting enough calcium into their growing bones during childhood, then there's a chance that they'll end up with short stature. And we know as many as 10% of children with short stature might actually have undiagnosed celiac disease. And, we really want to correct this problem for children before short stature becomes permanent for them into adulthood. So we don't want to know about poor bone health by the late consequences. So we don't want to know because you're an adult with short stature or because you're an adult that comes with a fracture that you should have been diagnosed with celiac disease in your childhood, and as often the case, might even have had symptoms at that time that were missed. So we traditionally use an X-ray test, which is called a DEXA scan, to scan individuals who are at risk of poor bone health. And what the DEXA tells us is how much calcium is in the bones, and then that amount is basically proportional to your risk of having a fracture. So it's compared to what calcium is expected in your bones for age and sex, and that number gives us an ability to predict your risk of fracture. The scan is done just while you're lying down on a machine bed as shown in the picture here, and the scanner moves above the patient, and it's a really quick test. It can take up to 30 minutes to measure as many as the whole skeleton and specific sites like the hip and the spine. So it is a radiation test, so there is a risk of radiation exposure, but this type of test has very low radiation exposure even compared to, for example, a chest X-ray. And we also have to remember that we're exposed to radiation every day when we go about our daily lives, and the amount of radiation exposure from this test, for example, is 10% of the amount that you would receive just from normal background radiation in your environment every year. So it's a low-risk test, low radiation exposure. If you need to have it, you can feel confident that it's a safe test to have. However, having said that, we don't want to scan children with X-ray tests at all if we don't have to and if they don't need to do the test. And as I'll explain later, we don't really need to do DEXA scans for children with celiac disease who are following a gluten-free diet. So using DEXA scans, studies have shown that at the time of diagnosis, as many as up to half of children in a clinic, for example, in my own clinic with celiac disease, might have low bone mass. And about 20% of those would meet the DEXA diagnosis or standard for having osteoporosis. And even fractures have been reported as the presenting sign of celiac disease in children, as also have osteomalacia and rickets, which are very specific forms of vitamin D deficient bone diseases. So definitely bone health is a problem for children at the time they're diagnosed with celiac disease. But what's important for children is that as little as 1 year after being on a gluten-free diet, bone health starts to dramatically improve. And what the graphs here show is children who have untreated celiac disease, their whole body bone mineral content, which is really essentially the amount of calcium in their bones. You can see it improves 1 year after being on a gluten-free diet and is starting to catch up to healthy controlled children. And over the next year or two, it will catch up if they stay on a gluten-free diet. The reason for that is the graph on the right shows that actually children who have celiac disease and are on a gluten-free diet actually accrue more calcium into their bones than healthy children, and of course more than children who are untreated with celiac disease. So they're actually rapidly catching up, and that's the advantage for children with celiac disease of going onto the gluten-free diet. So the longer children are on a gluten-free diet starting from childhood, the more likely they are to have normal bone mass for their age and their sex. And the problem, however, is for children and adolescents who don't follow the gluten-free diet. So for that population, there will be a risk of having lower bone mass than expected. So that's a carry-off from starting off with low bone mass and then never getting the catch-up because the celiac disease damage continues in the bowel and they don't heal the bowel and catch up with laying down extra calcium into bones. So clearly the key aspect for children with celiac disease to healthy bones is to being on a gluten-free diet. And a gluten-free diet is in fact superior to any other treatment we might offer, including vitamin supplementation. But having said that, we do quite often recommend vitamin D supplements for children. I do, especially in my clinic in Alberta, because really in Alberta everyone should be on vitamin D all the time because of our lack of exposure to sunlight over the winter months. So we know that vitamin D deficiency can be very common in children with celiac disease, and there are some studies that suggest that having better vitamin D levels will correlate with their bone mass. So we absolutely would recommend, no matter where you live globally, that if you have celiac disease, it would be reasonable to take vitamin D supplements during the spring and winter months because of the low amounts of vitamin D supplemented into the gluten-free diet and the lower sun exposure in those months. So which children are at risk of celiac disease? Well, the key message there is really all children with celiac disease. So at the time children are diagnosed, studies that have shown low bone mass, it hasn't mattered what the biopsy result was, how much intestinal damage there was, what their blood test result or anti-TTG level was, and it hasn't mattered whether they had symptoms or not, which is one of the key reasons why we really do want to pick up children young who have relatives with celiac disease or who have other reasons to be specifically screened. An important risk factor really, I think, for adults with celiac disease is that perhaps their childhood onset celiac disease was missed, and that comes back to those very subtle symptoms that sometimes doctors forget to look for celiac disease and need to remember. So the other risk factor, of course, for going forward is not following the gluten-free diet. So for children who go onto a gluten-free diet and are being very adherent and are doing well, I wouldn't do a bone density scan, but I would worry about children who I know are not following their gluten-free diet, and I would start to investigate their bone health at that time. So this is just some results from my own clinic that show the children who came to the clinic with symptoms of celiac disease, which are the blue diamonds, compared to the children who didn't have any symptoms with celiac disease, which are the red squares. And then looking on the left-hand side, the Z score is the score that we get from the DEXA machine, and the lower that score, the worse your bone health. We don't like it to be below -2 because that means you have osteoporosis, but even below -1 might tell us that you're at risk if you don't go on a gluten-free diet of developing osteoporosis. And you can see it didn't really matter whether the children had symptoms or not, just as many of them had poor bone health with and without symptoms. So children with celiac disease, as I've said, don't need a DEXA scan if they start and follow a gluten-free diet, and they will do well and achieve their genetic potential for healthy bone mass for their age and sex. But definitely DEXA scans should be considered a year or more after diagnosis if children are, or their parents are reporting that they're not following a gluten-free diet. So bone health and celiac disease is a problem, but if diagnosis is made early in childhood and children grow into healthy adults who follow the gluten-free diet, bone health shouldn't be a problem and is something that we can prevent and improve by making the diagnosis and by helping children and adults follow their gluten-free diet. So I'm going to hand over back to Melissa now, and then we'll hear from Shelley.
Okay, great. Thank you so much, Justine. And I'm just going to turn it over to Shelley.
So thank you, Justine. That was a wonderful overview, and I'm going to focus a little bit more on celiac disease and bone health, more with an adult focus. And I really appreciate this opportunity. So thanks to the Celiac Association for this evening. So celiac disease and bone health are two very common health issues and not very glamorous health issues, so often don't get the well-deserving attention that they do need. And if we look at celiac disease, the sort of most current number I've read is they are estimating that it affects 1 in sort of 130 people, and osteoporosis is very common as well, where we know that 1 in 3 Canadian women will likely suffer a fracture due to osteoporosis in their lifetime, and 1 in 5 Canadian men. So we want to look at the link between these two health issues and sort of put the picture together. If we could go to the next slide. We also know that osteoporosis, or celiac disease, it's kind of like an iceberg. So sometimes we diagnose it quite quickly. Oops, sorry, I'm going pretty fast here. So I don't have any disclosures, and my objectives tonight are just to review the bone health nutrition guidelines. And so obviously the cornerstone of that is a gluten-free diet. So I won't be speaking a lot to that, but where I want to spend the majority of my time is really looking at how to optimize the calcium and vitamin D. And we'll talk a little bit about management of lactose intolerance and just a brief touch on protein. And then depending on time, we may talk a little bit about caffeine, sodium, and alcohol effects on bone health. But the really big ones to concentrate on are the calcium, vitamin D, lactose, and protein. So if we could go to the next slide. So there's that iceberg that I was talking about. So as I understand it, unfortunately, people with celiac disease often have symptoms that are sort of diagnosed or not taken seriously, and it can take several years before a diagnosis of celiac disease is picked up. So that's sort of the group that's the surface of the water, but there's that whole group underneath that have symptoms and are sort of undiagnosed. But the bone health connection can affect both groups. So we do know that when someone is treated with celiac disease, they often do have bone loss. So not only in the pediatric population that Dr. Turner talked about, but also in the adult population. And again, if we look at sort of, does this bone loss translate into increased risk of fractures going down the road, which is our primary concern, there is a link there. So 30 to 40% of people with celiac disease are at increased risk of fracture over time, and in specific, almost 70% increased risk in having a hip fracture. So no one wants to end up with broken bones and fractures. So it's really important to sort of get a handle on that. Next slide, please. So fortunately, there is starting to be more and more awareness. I did find information about a survey that was done looking specifically at people with celiac disease that were members of the Ottawa chapter of the Celiac Association. The survey was a few years old, but looking back there, lots had undergone bone density tests, and almost a third had been diagnosed with osteoporosis. 10% had osteopenia, which simply means low bone mass, and it's a word that we're not using as much these days. We tend to look more at the fracture risk. A significant number had already broken a bone, but what I'm really concerned about is this numbers towards the bottom. Only 5% were taking calcium and only 5% were taking vitamin D. So hopefully things have changed a little bit in the interim, and by the time the night is over, I'll hopefully convince you that we have a little bit more work to do in that area and try to up those percentages as much as possible. The next slide. So what's the link specifically between celiac disease and bone loss and osteoporosis? Well, an obvious connection is malabsorption. So if the GI tract is damaged because of exposure to the gluten protein, then it affects the absorption of many nutrients and vitamins and minerals, especially the calcium and vitamin D. This damage to the GI tract can often lead to lactose intolerance, which often is temporary, and I'll speak to that. Sometimes, if you're not absorbing nutrients, there's ongoing weight loss, and weight loss is an independent risk factor for osteoporosis. So as a general rule for women, if most of their life they've weighed less than 132 pounds, or men 150 pounds, that's a risk factor for osteoporosis. So if we are already small and then losing weight because we're not absorbing nutrients well, then that can have an increased osteoporosis risk going forward. Dr. Turner spoke about sort of the life cycle of bone and how we accumulate bone when we're young, and then draw on that as we get older. But if we never reach that potential because of lifestyle choices or illnesses or things like that, when we lose bone, which is part of the natural aging process, then we're starting from a lower base, and so we can get into trouble a little bit earlier. And more there's research sort of looking at if we have celiac disease and there's inflammation happening along that GI tract, perhaps we're producing some chemical cytokinins that cause chronic inflammation, and is that sort of the link and why we see more osteoporosis in this population. So some interesting research happening in that area. So the next slide really shows you a picture of that digestive tract. So in the image on your left is a healthy is a healthy lining in the small intestine, and hopefully you can see those little finger-like projections, and that's where the nutrients absorbed. And because of those finger-like projections, it really increases the surface area over which to absorb the nutrients. So there's a lot more nutrient absorption compared to the one on your right is a biopsy taken from someone who has celiac disease, where all those villi are flattened out. So it reduces the surface area, and therefore you have more difficulty in absorbing the nutrients as we would expect. And once we implement the gluten-free diet, healing does take place, and the lining of the gut can revert back to that picture with those finger-like villi that we would expect. So next slide, one of the cornerstones, as Dr. Turner has mentioned, in terms of keeping the bones healthy and strong and fracture-free, is following a strict gluten-free diet once we know you have celiac disease, and following that forevermore, because even tiny little bits of gluten exposure can start to affect that GI tract and cause that damage. So it's a strict gluten-free diet, and there is very good evidence that that can lead to increases in the bone mineral density, and that we can recover that if there were some preliminary losses because of the diagnosis and sort of figuring this out. But the greatest increases occur in the first year, but there is some limitations with that statement, because a lot of these studies have only followed people for a year. In some of the studies that are following people further out, 2 to 5 years, they are seeing some ongoing gains, but it is certainly more significant in that first year. And they can see gains in bone mineral density of up to 5 to 8%. But again, we don't only just want to see increases in bone density, we also are looking to make sure that the risk of fracture decreases over time, and there does seem to be a connection there. So again, we can throw all the calcium and vitamin D at the skeleton, but if you have if the gut isn't absorbing it well because you're not adhering to the gluten-free diet, it's not going to do you're not going to get the best out of it. So let's move to the calcium and vitamin D. So there are different numbers out there about how much, and there is some different opinions. In our clinic, we tend to follow the guidelines from Osteoporosis Canada, which are just under review, and we expect some new guidelines to be published later this year. But basically what we're looking at is for individuals over age 50, 1,200 milligrams of calcium per day. And what's important to remember is this represents the total amount of calcium throughout the day. So you would take into account any dietary contributions combined with any supplements, and the grand total is a goal of 1,200 milligrams a day. There's really no benefit to super exceeding that, and we'll talk a bit more about that. Next slide, please. So calcium is a very abundant mineral in the body. The majority of it is stored in your skeleton, in your bones and your teeth. But there is a little bit of calcium found in every living cell in your body that does a lot of really important functions, like regulate your heartbeat, help your muscles relax and contract. And the body very tightly regulates that calcium at that level. And it depends on you supplying enough every day through diet or a combination of diet and supplements to keep everything in balance. But if you don't have enough calcium coming in, then the body's backup plan is to withdraw it from the skeleton, and there is a lot there. But if you're continually at the bank taking out some of the stock inside, eventually over time, the bank gets a bit depleted, and then that can be a risk factor for osteoporosis. So there's really no grace period. You need to work to get enough dietary calcium on a daily basis, on a very regular basis. So next slide. So where I like to start is always by looking at the diet. So there's lots of different tools out there. Osteoporosis Canada website has an excellent calcium calculator, as do some of the Canadian dairy farmers have some good resources. But just looking at a list of foods and their calcium content, and then just sort of thinking, how often do I have these foods? When I eat them, what is my portion? And then you can quickly do some calculations to figure out how much calcium you're getting from your diet on during each day. And the average Canadian, it's around 600 milligrams, and that's staying fairly stable. Some of you might be more, some of you might be less. Next slide. So a common question I get is, well, you know, I eat salmon or I eat broccoli, I can get all my calcium. And certainly those foods do contain calcium, but you do need a significant amount of them to get the calcium. So if we're comparing you get about 300 milligrams of calcium in 250 ml portion of milk, which would be equivalent to 6 oranges. And I doubt that most people would eat 6 oranges 3 times a day. So all these foods do factor in, but it's often difficult if they're your primary source to get you to that 1,200 milligrams a day. So there's if we look at the next slide, just kind of a little worksheet that we work through where we take into account sort of the amount that you get from your diet and compare that to the total. And if it's around 1,200 milligrams, perfect. You're getting all the calcium you need from your diet, good to go. But if there's a gap between sort of what you're getting from your diet most days and the recommended amount of either 1,000 or 1,200 milligrams a day, then we have to have a bit of a discussion. How can you increase that? Is there things that you can do with your diet to bring that up closer to the top, or do we need to look at adding in a supplement? So if we go to the next slide, the supplement world is this was just looking at the for those of you doing some label reading, you can look at the calcium on the side of the product. So this is for 250 mils of milk. And if you look at the calcium there in the red circle, it says 30%. So people say, well, you're talking milligrams, but the label says percent. How can I translate those? So a little rule of thumb, just a little trick, and this only works for calcium, no other nutrient. But basically, if you put a 0 behind that number, so 30% or 300, it would give you about 300 milligrams of calcium in that serving. And if we look at the next product label, Parmesan cheese, if you had 2 tablespoons, it would give you 10% of your daily calcium or 100 milligrams. So then you can use your labels to help you figure out your dietary calcium a little bit more. So if we progress, there's lots of different tips and tricks for sneaking calcium into your diet. These are a few of them. A nice popular thing these days is the lattes and things like that are made with milk or milk alternates that can sneak it in. The next slide has some ideas. Skim milk powder incorporated into different recipes is a great way of sneaking in calcium without altering the taste. And if you like things, cream soups or cream sauces, evaporated milk, because it concentrates the calcium, is a great way to sneak in some extra calcium and a little bit of extra protein. And the market is responding, as we'll see on the next slide, with lots of products. For those of you that don't like dairy or stay away from it, you can get the fortified soy, rice, or nut beverages, but just make sure they are fortified. And remember that the calcium in those products settles. So to really shake those up before you pour them into your glass, you can purchase fortified orange juice that has both calcium and vitamin D in it. And then fish, if you're eating the bones, offers some calcium, but if you pick out the bones, then it's not really a calcium source. So if you just can't do this with food, then there's tons of supplements and there's shelves of them. And so on this slide, it just lists some of the different forms: carbonates, gluconates, lactate. And so what we really want to look at on these supplements, because the price can vary from $50 a bottle to $10 a bottle, what we want to know is, how do I choose from this wide range of products something that will work for me? And so really what you have to do is, if we go to the next slide, is look at the fine print on the label and look for the word elemental. That's the amount of usable calcium in each of those products. And it can vary widely, as you can see from this. So generally this information isn't on the front of the label, it's on the side. And so you need to read carefully. If you take a tablespoon of this or 1 tablet of this, how much calcium are you getting? And you need to know that elemental calcium portion to determine the appropriate dose. So if your diet is giving you 600 milligrams of calcium, for instance, on a regular basis, and you took one of the caltrate there at the top of the list, 600 and 600 is your 1200. So one of those would be enough and you'd be good to go. But if you look at the bottom there, the gummies, which are pretty popular, they only have 250 milligrams of elemental calcium per gummy. So you would need 2 of those to balance that off with your diet if it's giving you 600 to be around that 1200 milligram mark. So it's just taking the time to read the product labels and look at the elemental portion to know the appropriate dose. And fortunately, as we'll see on the next slide, the market is responding because some people have trouble swallowing. Calcium is a fairly heavy mineral, so the tablets tend to be fairly big, but now you can choose from syrups, there's chewable calciums, there's powders, there's flavored chews, so you can get to different forms that you may find more tolerable for you. But again, you just have to read the product label to know the elemental, to know the correct dose, because sometimes you don't need the full 2 tablespoons giving you 1,000 milligrams. That might be too much because your diet is already giving you half of what you need. So just balancing that out a little bit more. And just a few tips for taking a calcium supplement. Generally, it is better to take your calcium with food. It often enhances absorption. The exception to that is if you're using calcium citrate, that can be taken any time of day. If you do have to take more than 1 calcium pill a day, it should be taken in divided doses. We don't absorb calcium the best, and so you want to break it up a little bit just to enhance the absorption. Many people do find calcium supplements a bit constipating, so make sure you're taking with plenty of water. Where I find that most people get into trouble with side effects with the calcium is they're taking way too much. So, they went to a presentation and got excited about calcium and went home and took 2 or 3 tablets, and then you will often feel constipation. So just introduce it very slowly and work your way up if you need more than 1 calcium pill or portion per day. Let the body adjust and sort of move slowly. And the upper limit for calcium is 2,500 milligrams a day. So take a look at your diet plus your supplements and keep that well below the 2,500. But really, the bottom line is there's no benefit to getting more than the 1,200 milligrams a day. Calcium is what we call a threshold nutrient. You get bang for your buck, getting your levels up to what's needed. Beyond that, not really. So you're just making the vitamin companies happy if you're taking all these extra supplements. So build on your diet, just use the supplements to fill the gap. And then you can purchase, if we look at the next slide, all these extras in calcium to help, they're marketed, this will do this and do that. There isn't really strong, convincing evidence. What we do know is adequate vitamin D is essential, and that's a key thing. But these other things in terms of calcium absorption offer no real advantage. And there is concern with the next, as the next slide points out, we do have to be careful with excessive amounts of calcium supplements. They can increase the risk for kidney stones over time, whereas dietary calcium has the opposite effect. The more calcium we get from our diet may slightly lower our risk for kidney stones over time. So a little bit is good, more is not necessarily better, and build on your diet. So let's move to talking a little bit about lactose intolerance, because often people with celiac disease, or often just people with osteoporosis, say, I have lactose intolerance, I have to stay away from milk. But in terms of lactose intolerance with celiac disease, it often is there when this is first diagnosed, because there's a natural sugar in milk called lactose. It's a fairly big carbohydrate model that has to break down into two smaller components. And there's an enzyme in your gut called lactase that does that. And it so happens that that lactase enzyme, if you think back to that earlier slide when it showed the healthy gut and those little villi, it's produced at the tip of the villi. So if they're damaged or flattened out, then you don't have a lot of that lactase being produced. So when you drink a glass of milk, that lactose sits in the gut sort of undigested and can lead to some uncomfortable sort of GI feelings. But once the gut starts to heal, when you adhere to the gluten-free diet, then the lactase starts being produced. And so often many people find that they can start introducing milk products in a slow, gentle way about 6 to 12 months after they've been on the gluten-free diet. And so if we look at the next slide, things that are tolerated better in terms of managing this are things that are fermented. Yogurt or cultured dairy products are often tolerated better than just a full glass of milk, as are aged or hard cheeses. Soft cheeses do contain a little bit more lactose, so you may want to start off with some of these others and then introduce the soft cheeses. And try having milk with meals, so not on an empty stomach, and just start with very small amounts, maybe a quarter of a cup. If you tolerate that, then you can maybe go up to a third, or maybe every other day, or things like that. And again, commercially, products are starting to be more and more available to help manage lactose intolerance. So you can buy milk now that has lactase enzyme added to it, so the lactose is broken down. And there are also liquid or tablet forms of the lactase enzyme that you can take with meals, or you can add to your milk products at home to do that work for you if you just find that things aren't improving over time. Because it's really nice to be able to include some dairy or some like that, because you're already eliminating a whole food group with the gluten-free diet, and now we don't want to have to sort of eliminate another whole food group on top of that. So if we can incorporate those foods in, that's very helpful. So just to wrap up on in terms of calcium, is aim for a grand total of 1,200 milligrams per day. And of course, we generally advocate for a food first approach if possible, and supplements just to fill the gap. So let's move on quickly and talk a little bit about vitamin D. So Dr. Turner has talked quite a bit about this as well. So the same principles apply to adults. So you really need the vitamin D, adequate vitamin D on board to help absorb the calcium. And again, different agencies have different numbers. If we look at the next slide, we go with the recommendations from Osteoporosis Canada. So we're a little bit more aggressive with our vitamin D recommendations in our clinic than, say, Health Canada. But you can find your age group and see what we recommend. So we do know, as the next slide shows, vitamin D is the sunshine vitamin, but there's a lot of buts there. So being in Alberta, the sun only activates the vitamin D synthesis process from sort of April to mid-October. So 6 months of the year we don't make it, even if we're out with skin exposed. During the other times of the year, we're using sunscreen, which can block the vitamin D synthesis, or we work indoors during the day, and so are missing some of the sun. So sun is a wonderful option, but it's just sort of our access is limited through no fault of our own. And so we're going to skip the next one. I've kind of talked about this. You can get vitamin D from food. It is added to all fluid milk products in Canada. So in an 8-ounce cup of milk, it's about 100 units. And again, if you remember how much we need about 800 to 2,000 international units per day. So it's pretty tough to get it totally from your diet. You can also get it from fish, mainly cold water fish, but most of us aren't eating fish very regularly. And then there are some other foods that provide smaller contributions. But if we look at sort of the reality of things, we'll just skip over this for now. What we often end up is needing a vitamin D supplement. And so generally, Health Canada says every adult over the age of 50 should look at a vitamin D supplement, but people with osteoporosis or celiac disease were even more diligent about that. So it does come in a variety of doses, so read your product labels closely. And it is in most multivitamins, usually about 400 international units, but the numbers do vary. And we do recommend that you read labels and make sure it's in the form of vitamin D3 if possible. That's a little bit more potent than the other forms. So again, label reading and mix and match. So you have to look at all sources and aim for a total of about 2,000 international units per day. And vitamin D is a little bit safer than we once thought. As you'll see on the next slide, the upper limit is about 4,000 international units per day. So we definitely don't want to exceed that. Now, the last nutrient I'll just mention in a couple of minutes here is protein is really, really important for bone health in everyone, and including people with celiac disease. It is the building block of every living cell in your body, and bone is 50% by weight, 50% of the structure of bone is protein. So we all need to be need to ensure that we're getting adequate protein every day. So on here is the current recommendations for protein. There is some emerging evidence that maybe this number should be a little bit higher as we get older. So perhaps we need even a little bit more protein than we once thought. The jury's still out on that. But it is fairly easy, as you'll see from the next slide. So for most of us, if we look at the protein content of sort of some common foods, that if you're just having a couple of servings of these throughout the day, spaced throughout the day, that you can easily get to sort of the 50 to 60 grams of protein that is recommended. Where I see people struggle more is individuals that sort of live on their own and are into that tea and toast regime. Their protein intakes can be very, very low, and that's just not a good thing when you have osteoporosis and the bone tissue. So it is important to pay attention to bone and protect the bones as much as possible. And the other thing is, if you actually have broken a bone and you're trying to recover, to heal from that fracture, adequate protein is critically important so that we don't delay the healing. So there's more and more attention being paid to protein and bone health as we move on. So just we'll advance to onto the next slide just to wrap up, so we have some time for questions. There are some other important factors for bone health. Caffeine has a negative effect on calcium absorption, so generally we recommend limiting caffeine to no more than 2 to 3 cups of coffee a day. But do remember, caffeine is also found in tea and soda pops and some drinks, so those have to be factored in as well. Alcohol, so 1 drink a day or 2 drinks a day for men seems to be okay in terms of bone health, but more than that seems to have a bit of a negative effect. So we try to recommend to limit it to 1 drink a day for women or 2 for men. Sodium has too much sodium. We need some sodium every day, of course, but too much can have a bit of a negative effect on bones. And then we've talked about the weight. So those are important factors to consider. So I think I'll end now, just so that we have a little bit of time for questions. And that's just a very, very, very quick overview of some important things to think about in terms of bone health and nutrition, and not only for people with celiac, but all of us in general, to keep our bones healthy and strong.
Great. Thank you so much, Shelley, for that. That was really comprehensive, and I was certainly learning a lot of new things that I didn't know, and I'm just catching up on your slides here. We're just whipping through a lot of great content, and I just want to make sure people have a chance to see the slides. But just to let everybody know that our theme this year for Celiac Awareness Month and throughout the year is going to be Go Beyond the Gut. And as Shelley was mentioning, there are a number of risk factors and symptoms that you may not contribute to normally think of celiac disease, such as anemia, bone health, neurological symptoms. So please check out our website at celiac.ca. It would be remiss for me not to mention that part of Celiac Awareness Month is that we are trying to raise some donations to continue us being able to provide awareness, education, advocacy. So we encourage you, after you've enjoyed this session, to consider making a donation to celiac.ca, or if your preference is also osteoporosis or both, you can donate at osteoporosis.ca. So in terms of questions, I have one. First is, and I'm not sure which of my experts here would tackle it, maybe Shelley. Are women who are pregnant at risk, greater risk during pregnancy with celiac disease for bone health issues, or is it because of the timing? It's not so much. You mentioned calcium's a daily intake thing. So can you give us a sense of, pregnancy and women? Because obviously, if there's celiac history, with the babies, then I don't know whether Justine can help us out on that front too.
I don't work a lot currently with pregnant women, so I'm not on top of sort of prenatal nutrition. Dr. Turner, are you?
So the biggest risk for women is, women have, during pregnancy and especially during lactation, have an increased need for calcium. So that's not different whether you have celiac disease or not. So obviously the only difference is that if you're not following a gluten-free diet, you're going to have trouble absorbing your dietary calcium and vitamin D. So I think for healthy women who are following a gluten-free diet, there's no evidence of increased pregnancy complications. There are obviously concerns for people who have undiagnosed celiac disease and have long-standing, malabsorption that may impact fertility. So that's more of a risk about getting pregnant. But for women who have celiac disease and follow a gluten-free diet, pregnancy should go well. But you do have to remember, if you are having ongoing symptoms, and many people are challenged even by contamination and things, that they're trying to follow their gluten-free diet, but they seem to be very sensitive to having symptoms, you're probably going to need to really be very carefully addressing your calcium needs, because lactation really sucks calcium out of bones. That's my understanding, Shelley, from the point of view of pregnancy and lactation, are quite high demands on your calcium and on your bones in that way.
Yes, and during lactation.
Yeah.
For sure, yeah.
Okay, great. Question here from Sherry. We can't eat bran muffins, so that may have been a slide that was up. What's an alternative to that?
Well, that's a really difficult one, because most whole grains contain some calcium. So if you have celiac disease and you can't have that group, then it's tougher to rely on that as sort of a non-dairy source of calcium. So I'm just racking my brain trying to think. Again, all of you probably have way more expertise in that area, sort of the alternatives to grain that you're using that maybe can supply a little bit of calcium instead of wheat bran or things like that.
We do have we had a webinar on nutrition. Unfortunately, we were unable to record it, but we do have the slides available. So if someone is interested, if they email info@celiac.ca, we can get those slides to you. And they were offered by, session was by Adriana Smallwood. and that maybe have some guidance there for
Can I make a
Yeah.
comment? You know,
Oh,
there
go
are
ahead,
some of the companies that make processed gluten-free foods are very good about fortification. So Celiac is one example where they will consider to fortify their products, because we're not getting fortification the way, you know, you will from standard like, for example, breads that are fortified with vitamin D. So it's worthwhile, you know, that comes back to label reading as well. When you're looking at the processed foods that you're buying, you know, can you see how much vitamin D they're adding to that food? So, because, you know, I think we're going to, if the more that we put pressure on the companies and we look for the best processed food sources, and they're the ones we're buying, they're all going to start coming on board and paying more attention to how they're preparing processed gluten-free foods.
Okay.
And there also is more like openness in the food industry, because before they were just limited to adding vitamin D to certain foods, but now it's allowed in cereals and a greater range of products. So that's helpful too. That's a change that's happening over time.
Okay. Question about vitamin D. Is there maybe a difference in what vitamin D you would take in the winter versus the summer? How much do we get from the sun, and then let's say during the winter, is there a difference?
Well, we just find it's easier to keep the same thing around the 12 months of the year. Some people, you know, would take supplements only in the winter and not in the summer, but then they were forgetting to restart. So just from a practical point of view, we often just say continue the same program 12 months of the year. All it takes in the sun is 15 to 20 minutes to make a fairly significant number of IUs of vitamin D, but the body regulates that. So, you know, if you're out in the sun way longer, it shuts off that. There's safety valves there, so you don't have to worry about that. And if you're still taking a modest supplement of 1,000 international units per day, that's not going to get you into trouble.
Yeah, interesting. Okay, didn't know about the shut off.
Yeah. And then the other issue is if you use a lot of sunscreen. So in Australia, individuals with dark skin, and I'm obviously Australian, you can hear from my accent, or individuals who are very heavy with their sunscreen use but don't spend a lot of time in the sun, can sometimes become vitamin D deficient as well. So, you know, the darker your skin, the harder it is for the sun to penetrate to make the vitamin D. So if you're using sunscreen, it might be 15 minutes without sunscreen, but you might need to be out during the course of a day for about an hour or two. So if you think of people who don't spend a lot of time outside, or when they do, they are only out for a short period of time and have a lot of sunscreen, they may not be getting enough. So we're the same. We recommend the same supplements all year round for children. We don't modulate it according to spring or summer. And that's just because, again, I agree, you're not going to go overboard because you have a few sunny days over the summer.
So Shelley, just to recap, what was that sort of target you're trying to go for calcium?
So up to
vitamin D?
Oh, for vitamin D. So up to age 50, it's 400 to 1,000 international units per day, and over 50 is 800 to 2,000. And people always say, well, how do I know if I go to the lower end or the higher end? That's when like, how much sun exposure do you get? Do you get a lot of dietary? Then you can probably get away with the lower end of supplements. But if it's no, you're never out in the sun and you don't eat any of these foods, then you probably need your supplements more to the higher end of the range.
And we have very similar recommendations for children. So we recommend 400 international units for babies, 800 for children up to 12, and basically the adult amount that Shelley said, 1,000 for children over 12. But we also do monitor vitamin D levels, and that's one of the recommendations for bone health for people with celiac disease, is that your vitamin D is monitored annually until it's normalized. So that would be your doctor working with you, or your dietitian working with you, to determine how much vitamin D you need in a year to get normal levels. And you will sometimes be, if you have very low vitamin D levels, people will sometimes recommend to give you much higher amounts. So you shouldn't be frightened about that if they're monitoring it. That sometimes we do need to give larger amounts to get the vitamin D level up to normal.
Okay, great. Well, here's a question after my own heart. What limits per day are there for orange pekoe tea?
Well, tea generally has a lot less caffeine than a cup of coffee. So depending how the tea is brewed, maybe 40 to 60 milligrams of caffeine per 8-ounce portion. So Health Canada says limit caffeine to less than sort of 300 to 400 milligrams a day. So you could have a fair amount of tea in there. Right?
Yeah, I tend to walk away from my tea, so I might be back to the 3 cups. So
the other thing about tea, there is a little bit of information to show that habitual tea drinkers, and it doesn't matter the kind of tea, it may confer some type of bone benefit. So there's actually an association with fewer hip fractures with habitual tea drinkers.
I tend
Not
to have my
so
tea
with coffee.
Okay, another question here on, can you please show the sodium slide? So I don't know if we can maybe go back. The
point there is was just that if we have really high intakes of sodium coming in, we lose calcium in the urine to process that. And so again, we don't want to be working hard to put all these nutrients in one end and something else is working the opposite. And so if you're eating most of your food at home and prepared from scratch, this is a non-issue. But if most of your meals are from a box or commercially made, it's the food processing that really adds the sodium. And if that slide was just making the point that 77% of the sodium in our diet comes from processed foods. So if those are just a minimal part of your diet, this is a non-issue.
Okay. Another great question. Most whole grains have calcium, so I recognize how difficult it is to find options on a gluten-free diet, and we talked about that a little bit earlier. Some great resources are with Shelley Case, who is also on our professional advisory council. She kind of wrote the book on celiac disease, and you may want to check that book out for some recommendations to get the calcium through that way. CCA has just also uploaded on our Go Beyond the Gut page. If you go to awareness and or even type in calcium, there's a document referenced by the Dietitians of Canada. It's called PEN, with some calcium recommendations, so you can check out there, and probably also on Osteoporosis Canada. I would imagine you've got some ways and recipes to get people to get that additional calcium through a variety of means, I would imagine.
Yes, and the calcium calculator if you want to play around with that.
Perfect. Oh, that's great. Yeah. So I just want to thank our speakers, Shelley Hagan from Osteoporosis Canada and Dr. Justine Turner from our own Professional Advisory Council